Hi, my name is Lloydet Priwa. I'm working on an app for nutritional management during cancer treatment. As you can see, some of the symptoms that cancer patients experience during cancer treatments: swallowing problems, anorexia, mouth sores, esophageal inflammation, xerostomia, nausea and vomiting, and taste buds alteration. On the app, I want to develop a score scale where it ranges from 1 to 10, and 10 being the most severe. And they can pick one of these numbers, click OK, and it will take them through a care pathway. That will help the user to start an assessment, and I'm using three criteria for the assessment: the onset, etiology, and also part of the medical management. Collecting history and trying to find out when the symptoms started would be very ideal as to part of the plan of treatment, and also the etiology as well. The care pathway would have three categories: mild, moderate, and severe. Mild from 1 to 3, moderate from 4 to 6, and severe 7 to 10 would let the user know as to the extent of the symptom. Part of the onset, especially for health professionals, would be to find out when the patient started having either any of these symptoms or a combination of the symptoms, and that will contribute to making a decision of plan of treatment. You can see here photos of mouth sores, which is very, very painful. Dysphagia, anorexia, mucositis, and esophagitis. Serious problems that affect people during treatments and affect their food intake. Having difficulty swallowing could be neurological, or it could be due to the disease process as well. Anorexia could be a side effect of medication, chemotherapy, psychological or social phenomena that the patient may have adapted to. The mucositis and esophagitis many times could be treatment related, highly due to chemotherapy or radiation, and could also be disease related if it has to do with head and neck cancer. You will sometimes see mucositis or esophagitis. It's very important for the patients to keep good oral care, so lifestyle could also contribute to that. Patients' taste buds do change many times with treatment modalities or combination of treatments. Chemotherapy and radiation are the biggest culprits, and you can see vomiting, can sometimes be related to CNS or anticipatory, or it could be also side effects of medications. Excuse me. Xerostomia, it's important to check the etiology to see if it's related to the parotid or salivary glands. Did the patient had mouth surgery, or is this also lifestyle related? Um, such as the nausea could also be um, anticipatory or a side effect. Uh, it could also be problems with emptying gastric contents, constipation, things like that. Or it could be, as I previously said, tumors of the CNS can also cause nausea. As part of the plan of treatment, um, it's very important for patients to have good dental care, oral hygiene, topical or protective rinses, um, systemic and topical analgesics also work, and encouraging the patient to modify their food textures, providing appetite enhancers, or even resting the whole GI system and using parenteral nutrition is sometimes done. It's also important to caution the patient if they have a systemic GI issue, to also be aware of discouraging sexual intercourse, douching, and for them to maintain good perineal care. And this should also alert the provider or the patient to also check for neutropenia. You can see an anatomical view of the stomach, and the stomach can also get very inflamed with certain treatments, or um, um, stomach cancers, or things alike. And in this situation, individualized drug combined regimen probably would be instituted, or TPNs, total parenteral nutrition. And it would also be good to monitor for dehydration, especially when vomiting is part of the symptoms. It's important for patients to be provided information and good treatment education prior to starting treatment. Lastly, it's also very important for fluid and electrolyte imbalances to be monitored. Monitor and keep in check with the weight loss situation, so that a patient do not really lose more than 20% of their weight. Monitor for esophageal tears or aspiration if blood contents are found in vomiting, during vomiting, or if it's seen Tarry black stools would be signs of esophageal tears or bleeding in the GI tract. Um, encourage patients to use sweeteners in their food to help their taste buds. They can chew gum to help the taste buds prevent the dryness or um, xerostomia situations in the mouth. And they can also include popsicles as part of their diet. This could help the vomiting situation, for dehydration, and for alteration of their taste buds. And that concludes this video. Thank you.